Ladies and gentlemen, welcome to this talk on socially responsible research in TSC. My name is Anna Jansen and I work as a pediatric neurologist in Brussels, in Belgium. What I will talk to you about today is about research that is developed in very close collaboration with the TSC community and as a response to questions coming from the TSC community. And I will use two examples for that. On the one hand, a workshop that I did and a project that followed from that on the development of a research agenda for TSC. And on the second hand, the TANDem project and TAND research as an example of socially responsible research in TSC. So let's get started. What is socially responsible research? Or why do we need to pay attention to it? Well, research agendas for health and biomedical research are usually determined by the priorities of research sponsors, such as, for example, pharmaceutical companies or national funding agencies, academia and academic researchers, such as, for example, myself, assuming to match the needs of non-academic users of research, being individuals living with TSC and their families. So these agendas risk to undervalue and underuse the specific knowledge and the expertise of patients, caregivers, healthcare providers, policymakers, the general public, and other non-academic users of research, leading to potentially serious mismatches between what researchers do and think they should do, and what non-academic users of research, being the TSC community, feel that they need. So how can we make sure that these two streams are aligned? Well, a first example came from this multi-stakeholder dialogue project. And the dialogue is really talk to each other. And I think that's really key in order to make sure that our goals are aligned. And so this is a project that was developed with support from the King Baudouin Foundation in Belgium, which is a philanthropic organization. And they wanted to make sure that the money they invest in research has the biggest possible impact on society. And to research which methodology could be applicable for that, we volunteered TSC as a pilot project. And so what is interesting in this exercise, or what interested me most in this exercise, is that a research agenda and research priorities were developed initially along two separate tracks. One for individuals with lived expertise in TSC, and in parallel to that, the exercise was done also with professional experts in TSC from different disciplines. But then very importantly, there was a conversation. We had a meeting where both the lived experts and professional experts explained to each other which priorities they had chosen, but more importantly, why they had chosen these priorities. And just making this thinking behind more explicit really was very helpful, was very helpful to understand each other's priorities and to make sure that we could come up with an agenda that represented the priorities of the entire community, of both of the professional and of the lived experts. And so for me, that was really a very, like an eye-opener experience. And that made me think that all the research that I perform, I just want to make sure that it is really aligned with the needs of the individuals and the people the research is for. So based on this exercise, 15 research priorities were developed, and the number one research priority was related to TAND, TSC-associated neuropsychiatric disorders. So it said, what are the most effective interventions to prevent, minimize, treat, and manage the different TAND-related problems in individuals living with TSC and their families? And so that brings us to TAND research. And even before this priority exercise was performed, there had already been research in very close collaboration with the TSC community, and that was done by Lauren Leclésio, who really pioneered this work under the guidance of Professor Petrus de Vries. And she led the foundations for what later would be the TANDem project, which truly is her legacy. And so following the consensus meeting for the guidelines or the recommendations in 2012, two decisions were made. Number one, to coin the term TAND as an umbrella term to avoid confusion about terminology, and 6 levels of TAND were defined. And the second one was to develop a checklist to facilitate it for families and individuals with TSC to have a conversation about TAND. Because families said it's often not addressed during a consultation or a visit in the clinic, for example. And so therefore, Lauren thought, and Petrus thought, that the development of such a checklist as a guide for having a conversation about these different TAND aspects might be a step forward. And so Lauren validated the TAND checklist and checked it also with the families to make sure that it really captured their concerns. And so then it was developed and translated in different languages. And Lauren did also something different because, again, going back to the community, after we coined the term TAND and after this checklist was developed, we thought like, oh, okay, maybe this will do the job. And then you all said like, no, this will not do the job because TAND is very different from one person to another. It can be so variable, and that makes it very difficult to know how to treat it, how to manage it. It feels like everybody's just paralyzed because they don't know how to tackle it. So that's why Lauren then said like, oh, maybe we could see if some of the features naturally cluster or group together. And based on machine learning techniques, she developed, so she did research in response to this question and developed, and 7 natural TAND clusters came up. And in the TANDem project, which I will address afterwards, we also used a wraparound psychosocial cluster to really ground all these different aspects. So then, are we done? No, we still were far from ready, because then came more questions. And maybe I'll immediately go to these. More questions came, the first one of which was, we'd like to have a self-report version and a quantified version of this TAND checklist, because then we don't need to wait for a visit to the clinic to be able to fill it out together with a physician. We can just fill it out ourselves and then not check if some of these TAND issues are present, but also measure how much of an issue there is. And if we have to set a priority in management, like where to start first, which issue should we address first, if we can quantify the TAND checklist, then we might also, that might help us guide to set our own priorities to know like where should we start, which issue should we address first. It was also asked to create a digital tool such as an app for the TAND checklist and to generate evidence-based guidelines and a toolkit for first-line management. So while you wait to see an expert or a specific coach, it might be good to have some tools in hand to start improving the situation yourself. And for this toolkit development, as I will illustrate immediately, it's very important to have your feedback and your input so that we can really double check that we're doing the right thing. Let's see if I can go back. No, it's impossible to go back. So, okay. Then, so this was really why we developed the TANDem project. These 3 questions coming from the TSC community formed the basis for the TANDem project. And so as part of the TANDem project, we also developed a website, which you can find here, tandconsortium.org, and there you can find all the TAND checklists in different languages, freely available and downloadable for families and individuals with TSC to use as a step up for having a conversation around TAND with their physician. We also have been working on the self-report quantified version of the TAND checklist. It still needs to be validated. It's not ready to be used as of yet. But here you can see that for each of the, for example, different behaviors, you can also quantify how much of an issue that is. And that will eventually lead you to help you set priorities for management. As part of the TANDem project, which really is an international multi-stakeholder participatory action research in close collaboration with the TSC communities, and family representatives are part of the project and guide each step. One of the second aims was also to develop evidence-based recommendations. And so some of the consensus guideline development, which has been done in the TANDem consortium, has been fed into the consensus recommendations updated version, which will appear very soon. And this is on TSC in general. Specifically for the TAND section, what we found important is to give the message not only to screen for TAND, but to also, when problems are identified, make sure something is done about them. So screen, act, and then very importantly, return, reassess, reevaluate, check if new problems have arrived, or if the management plan needs to be adjusted. Last few words on funding. There are a number of funding agencies. These can be pharmaceutical companies, but also, very importantly, national funding organizations such as in the US, the National Institutes of Health, which are a major funder for TSC research, and then the Department of Defense in the US, the TS Alliance in the United States, also very important. And then in Europe, we have much less funding for TSC, but luckily there is a TSC Association, and for example, in the Netherlands, the Stichting TSC Fonds. Why is this important? Well, they help address the gaps because of their funding, some of these gaps are slowly being addressed. For example, non-pharmacological intervention studies, which were clearly a gap. And now, funded by the NIH, there are 3 intervention studies ongoing, as highlighted here. And also, the TS Association is funding an intervention program, which is highlighted on the top here. And very importantly as well, there is a project that addresses access to care, which I'm very curious to learn more about. Better understanding of accessibility of mental health services for children and young people with TSC. So, have we arrived? Are we there yet? Well, that brings me back to these 15 research priorities that have been developed 3 years ago. And when I address the, just leaving behind the number 1, which is partly tackled by the TANDem project, it does not cover everything, there are still highlighted in orange multiple other research priorities that are currently not addressed by the available funding resources and by the researchers in the TSC community. So it means we still need to keep collaborating, keep speaking, keep dialogue to each other to make sure that all these issues are addressed and that the research that is being developed is as closely aligned as possible with the needs of the TSC community. So I will end up by encouraging you to keep up the dialogue, and I would like to thank my TSC partners in crime in Brussels, Peter Jansen and the team, BTSC in Belgium, very important support, the whole TANDem family, and Petrus de Vries, who has been a partner in crime for all the TAND research over the past year. So thank you very much for your attention. I'll be happy to take any questions.